Hi, everyone. Welcome to today's podcast, where we will be discussing if this pandemic crisis can represent a starter point for using e health as a queuing solution for the waiting times on the Portuguese national healthcare system. With us, we have our very special guests, Dani, Marcela, Max, and Zé. So, first, we are starting our podcast by explaining the process flow diagram of the elective surgeries. We will move on to defining the problem as well as identifying the different problem areas. We will then discuss how e-health tools can help and how the e-health solutions relate to the queuing theory. For a better understanding of the topic, we thought it would be important to give you a brief introduction to the queuing theory.
A queuing system is an analytical model that allows researchers, such as mathematicians and economists, to understand how long does it take for someone to be served. For this to be possible to measure, we need information about how many people arrive, how long does it take to serve someone, and how many servants there are available. Through these three analytics, we can calculate an estimation for how long people have to wait and/or to be served, allowing to identify and solve any existing bottlenecks.
So now let's go to the process flow diagram of the elective surgery. After reading materials from the Entidade Reguladora de Saúde and a master thesis regarding the management of waiting time for elective surgery, we found out that a patient without medical insurance in Portugal undergoes the following processes. So let's assume that now a man in his 40s goes to the local health center queuing in a very early morning, let's say 7 a.m., so that he can get a ticket and register himself with a staff at the local health center. For people who can't get the ticket, he still need to register first and then wait for 15 days maximum in order to have the consultation at the local health center. If this man successfully gets the tickets and after the registration, he spends some time waiting for his turn at the local health center. Finally, he could consult his family doctor and the doctor will decide if he needs to be transferred to the public hospital. If not, the patient stays at the local health center and receives treatment there. Assume that the man we're talking about successfully gets a reference to outpatient clinic of a public hospital from his family doctor. He then goes back home and waits for the notification from the public hospital. The maximum days for outpatient doctors to confirm the reference is 5 days. After that, he receives the first consultation notification via post and waits again for his first specialty consultation in the public hospital. The waiting time for this process is usually divided into three different categories according to the seriousness of the disease, including normal, prioritized, and highly prioritized. You will have to wait for 150, 60, and 30 days respectively. After waiting for a long period of time, it's finally the day for you to consult the specialty doctor. If the doctor thinks that prescription is okay for you, you will probably take that and go home afterwards. If the specialty doctor thinks that you need further treatments, he or she will make a programmed health care plan for you and decide what kind of medical examinations you need. The time for the doctor to make the plan here varies again from 1, 7, 30, and 60 days depending on your severity, and then you need to finish the medical examinations during 15, 30, and 19 days. Then let's continue to see what happens if the man is diagnosed with a disease which requires him to take elective surgery after having some medical examinations. He will be put in the Portuguese elective surgery waiting list and then wait for the surgery. The waiting time here depends also on the severity of the disease. In accordance with the Portuguese elective system, there are four classifications which are normal, prioritized, highly prioritized, and urgent. The maximum waiting time for these classifications is called TMRG, which refers to 270, 60, 15, and 3 days respectively. If everything goes well, you'll take the surgery in the hospital and then recover either in the hospital or go home, and then you will be at the last step of this process flow, which is having continuous medical care or consultation via further bookings. However, things are not the same as what people expect because if your original hospital cannot arrange your surgery between 50% of the maximum waiting time, the Portuguese National Health System will arrange your surgery in other public hospitals. If the SIGIC cannot arrange your surgery in other public hospitals, you will have to wait until 75% of the maximum waiting time. so that the Portuguese national health system can grant you a certificate. With this certificate, you can go to any hospital, either public or private, as long as they have signed a convention and cooperate with the SNS to do your surgery. If you reject this opportunity or want to stay at your original hospital, you will have to wait until 100% of the maximum waiting time, and you will receive the certificate again. For the following processes is almost the same. You can finally do the surgery and recover either in the hospital or at home. After that, you receive continuous medical care or have consultations via further bookings.
As we are all part of the current crisis, we are taking a deeper look on the negative impact COVID-19 has on processes in the healthcare sector. Due to COVID-19, almost all processes in the economic sector have been disturbed to a greater or lesser extent. COVID-19 has also required significant restrictions in the healthcare sector. For example, elective interventions, which are operations and procedures not vital for the patient's health, were postponed at the beginning of the crisis, as intensive care beds were occupied for COVID-19 patients. In addition, patients have developed a fear of hospital visits over the last weeks and months, and appointments for elective operations have not been taken. This has resulted in an increasing number of patients waiting for elective operations. Accordingly, this poses several challenges for the healthcare sector. On one hand, they have to find alternatives which could reduce or completely take the fear of the people visiting a hospital, and on the other hand, they need to find a way which will reduce the number of patients in the queue for elective operations, preferably also reducing the fear factor of the patients at the same time. eHealth could be a fitting solution in order to answer these specific challenges, as it enables a lesser patient cycle time and allows a minimum of confrontation between healthcare professionals and patients.
So now let's go to the problems areas in the process flow. Here it comes to the three general problems in relation to what we have discussed. The first one is too much time is spent on local health centers just to consult a family doctor if you cannot get a ticket on the day. And the second one is the programmed healthcare plan seems to be taking too much time since it's just a plan for doing medical examinations. And the third one is sometimes after surgery consultation is simple and might not require face-to-face consultation. On the other hand, the Portuguese Health Authority, o Ministério de Saúde, urged elective surgery patients in the beginning of March that they should not go to hospitals to proceed with their surgeries. Many patients who are qualified to do elective surgeries decided to postpone until the pandemic is over. As a result, some problems will likely be caused when COVID-19 is over, since the stagnated surgeries will take place altogether and new patients who did not have the chance to go to medical consultation during the lockdown will rush to local health centers. So the first one is local health care centers are likely to be overwhelmed as the first stage of medical consultation given their low service rate. Second is outpatient clinics will also be pressured as more patient cases will be transferred to public hospitals. This could also happen to diagnosis and medical examinations. Third, qualified elective surgery patients who did not proceed with their surgeries during the pandemic will stay in the waiting list, while new patients will be added to the list as well, giving more pressure to the already overloaded waiting list. And the last one, communication with patients regarding surgery locations and dates will also suffer from large pressure as a great amount of rescheduling takes place together.
Looking at different e-health options can be beneficial. By turning to technology to help alleviate some of the demand that healthcare will undoubtedly face after the coronavirus epidemic, can help pave the way for an acceptance of technology as a means for communication, therapy, and products within the healthcare community. In response to managing the fear that people have of visiting hospitals, moving to a more online/hands-free approach could be beneficial. Because keeping the human element in healthcare is important, online video consultations with your family doctor could be a solution for patients who are afraid to visit hospitals or other general health clinics. They can write out online prescriptions that can be sent to the pharmacy of choice or recommend you to the general hospital or outpatient clinic without meeting in person. Within hospitals, reducing human interaction will also reduce the fear. By using electronic tools for registration, checkout, and to help monitor the patient's KPIs and vitals, this can lower a patient's fear of undergoing operations soon after COVID-19. E-tools can also assist in reducing the wait time that patients will undoubtedly face when people feel more comfortable undergoing elective surgeries. By moving certain parts of the process, such as registration and checkout, to online methods, it can also allow for a decrease in the amount of time a patient spends in the system. Some tools that could be implemented are online forms that collect registration information that is sent to the patient a day before their appointment, and apps that can notify the next patient in the waiting list when the hospital has an opening. Likewise, in checkout, use of electronic ledgers, online prescriptions, and paperless records sent to patients via email could be ways to make it easier for patients to be discharged faster. In turn, it will allow the hospital or clinics to be allowed to see more patients, decreasing the time a patient waits for their appointment, thus allowing the hospital and clinics to work at full capacity and efficiency.
The theory behind the solution. The elective surgery queue, as described, is a multiple server single-phase queue. As the patients arrive, they queue in a single line and then proceed to one of multiple doctors. The arrival rate is Poisson distributed, and the service time is exponentially distributed. We can describe it using Kendall's notation as NNC. Currently, due to the COVID-19 pandemic, health centers had to reduce their patients' arrival rates in order to fulfill the new required sanitary regulations, creating a bottleneck in the first step of our system, going to the local health center, as according to Little laws, by reducing the arrival rate, we will diminish the length of our system. Adopting e-health solutions would make it possible to fulfill the new required sanitary regulations by allowing for the registration of consultation, monitoring, and checkout to be done through online means, therefore enhancing our arrival rate and serving utilization. E-health also allows to provide a more accurate estimation of queue time and better schedule appointments by encouraging clients to come during slack periods.
Thank you guys so much for joining us. We hope you enjoyed it. We also want to give a special thanks to all of our guests and also to Duarte, Edison, and Eric for contributing to the making of this podcast. For any further information, the sources consulted were the Entidade Reguladora de Saúde and Ana de Souza's master thesis regarding waiting times for elective surgeries in the Portuguese case.